Hi, everybody. Today we're going to dive in on the topic of English language proficiency and its critical role in assessing work readiness for international healthcare workers seeking entry to practice in English-speaking countries. It's an important topic for us here at CGFNS since part of our role is validating the passing scores of VLP testing for health workers applying for access to jobs in the U.S., Canada, and other countries. I'm talking today to Spiros Papageorgiou of ETS, Educational Testing Service, a global language research and evaluation company well known for their development and administration of proficiency exams like TOEFL and TOEIC. Spiros is a principal measurement scientist in language and learning assessment at ETS and is an expert in test development and validation. And he's unpacking today the theory and reasoning behind language proficiency benchmarks, how cut scores are set, how these evaluations can be somewhat but not always predictive of professional success, and overall he wraps some very needed humanity around this entire subject. So don't go away. This episode starts in 3, 2, 1. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing, scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by CGFNS International. Hi, everybody. Welcome back to Care Anywhere. Excited for this episode today where we're going to be diving in on the role that English language proficiency evaluation plays in workforce movements, migration, and decision credentialing. As you guys know at CGFNS, evaluating and verifying English language proficiency scores is part of what we do to support health workforce members who are looking at career mobility. So excited to welcome Spiros Papageorgiou today with ETS. Welcome, Spiros. So glad to have you. I know we're going to dive in on a great discussion around all these things, and would love for you to just say hello to our audience and tell us a little bit about what you do, the work that you do there at ETS, maybe a little background, and then we can really jump in.
Thank you. Thank you very much for the invitation. I would like to start with a very short personal anecdote. This is a very personal discussion for me as well, because I'm actually married to a nurse. My wife is a native speaker of English. Her first language is English, but she's been working in healthcare for several years now, both as a bedside nurse and now in organizing clinical trials. So this is a topic very close to me for a number of reasons.
That's awesome.
But from a professional perspective, so most people probably know ETS as a developer of assessments of tests. But ETS is more than that. It's actually a very large non-for-profit research organization, and that's where people like me come in. In the research institute of ETS, we have several different teams. Our team specializes in language learning and assessment. So people like me, we have a background in teaching English as a foreign language, and several of us specialize with degrees in language assessment, not just assessment, but language assessment. Yeah. So at ETS, our team works primarily on general research, foundational research for English language learning and assessment. Our goal is to learn more about how to better evaluate English language proficiency, but we also do this kind of research to support the English language portfolios, product portfolios that ETS has. So I personally work on the TOEFL portfolio and specifically on the TOEFL IBT test, which is a test that is used widely around the world to certify language proficiency, and it's widely known as one of the first language assessments used by international students for many, many decades, and also professionals coming to the United States and other English-speaking countries, not just the United States. It's also used widely in Australia, New Zealand, the UK, Canada, and so on. So more or less that's what I do at ETS, focusing in research on English language proficiency, but also specific work that has to do with research supporting the TOEFL portfolio.
Awesome. Thank you for that introduction. And I think understanding the research that really underpins the product portfolio and the work that ETS does is important because it's a complex subject. It's not a cut and dried cookie cutter proposition to determine language proficiency, English language proficiency, or any other language proficiency when you're looking at it on a role by role, case by case basis, because it's really tied, especially for work, around the job requirements and what's needed to perform the job. So let's talk about that. Obviously, it plays a role in career mobility, especially in high stakes industries like healthcare, which we've talked about. Validated proficiency is an entry to practice requirement for most English speaking countries. I would imagine across most professions for which internationally educated workers are looking to step into those industries. Can you let's talk about benchmarks, because that's sort of the framework upon which this is set, right? How someone determines what the minimum proficiency or skill level would be needed to perform a specific role, and then how are those benchmarks determined and who sets those, because they vary from industry to industry, right?
This is a very important question, because let me just start by simply saying there's no universally accepted benchmark out there that everyone can just read the book or read some kind of chart or table and say, okay, this is language proficiency for nurses, this is language proficiency for this profession. Unfortunately, we don't have that. We do have what we typically call language proficiency frameworks or language proficiency standards around the world. One example is the Common European Framework of Reference that defines language proficiency across 6 main language proficiency levels. It's very widely used by governments to set language requirements for study, for professional migration, and so on.
Right.
In Canada, we have the Canadian language benchmarks, and so on. The problem with these benchmarks is that on purpose, they're designed to be very generic. They have to, because if they're not very general, then they don't have a wide application across different contexts, across different professions and domains. They're useful. They do help us think about what it means to be at a proficiency level. They provide these sentences, these statements, these proficiency descriptors, as we call them, that say, at this level, you can have a conversation with, another speaker of English and communicate your basic ideas. We can think about people we know. I'm a learner of English myself. So if you think about people you know, you can start talking about these can-do statements. What can they do? Can they have, a conversation with a first language speaker of English and convey simple things like their name, their family situation, and so on.
Right.
So that's one thing. It's a little bit complicated to just say, how do we define language proficiency, let alone how we define language proficiency for specific professions. Now, what we typically do in practice, though, is that we need to come up with some definition. And one way to do that is, let's say we have a panel of specialists in healthcare, and we want to decide on using a language proficiency test for healthcare professionals. What we really need to do is we need to define a minimum score. So you'll hear me a lot talk about minimum score requirements or CAT scores. Okay, that's the operationalization of this definition of language proficiency. So I'm going to use TOEFL IBT as an example here. We have a 120-point score scale. One way to define language proficiency is by saying, there's a requirement for 90 out of 120 on TOEFL IBT. So then we go from a very abstract definition of language proficiency, such as the one we see in these general language proficiency frameworks, down to something very specific, which is a language proficiency score. One way to do that is to invite, as I said, a panel. You can invite language teachers who specialize working with adult learners, because typically in healthcare, you're dealing with adult learners of English.
Right.
You're not dealing with young learners, with kids. You can invite healthcare professionals who don't have a background in language proficiency, but work in context with international nurses, doctors, other healthcare providers, because you need these different perspectives. And then you sit down with them, you follow a very principled methodology called standard setting. You define the minimum requirements in terms of statements that describe language proficiency, and then you try to match the score scale, the scores of the test, to this definition, and you come up with a recommendation that this is the minimum requirement for language proficiency. So bottom line is, unfortunately, there's nothing out there that is the Bible that describes language proficiency for healthcare workers, for example.
Yeah.
We need to work on that definition.
Yeah, absolutely. So I know that there's probably a difference between speaking and listening,
Right.
et cetera. So there are 4 skills that you guys really look at when you're determining proficiency levels within this spectrum, right? Can you talk about that a little bit, how those skills are assessed?
Yeah, so for decades now, the field of language teaching, not just language assessment, talks about language proficiency both as a unified characteristic of humans, but also one way to compartmentalize this ability is to think about different language skills or modalities or different terms. I prefer the term language skill. And traditionally, we talk about speaking, listening, reading, and writing. And if you look at textbooks that are used in schools in countries where English is taught as a foreign language, what you will see is that the course plan, the classes are built across those definitions of the 4 language skills. So you get activities to teach pronunciation for speaking, or to teach how to develop cohesive devices for writing, and then practice your listening skills and then your reading skills and so on.
Because there's a different process for receiving language, receiving language versus communicating, right?
Absolutely. And because of that, there's also different ways of eliciting evidence of proficiency in these different skill areas. So when we want to evaluate reading, we do it in a specific way. When we want to evaluate writing, it's a different way.
Right.
Another way to think about that is the productive language skills. That's another kind of more general definition. Speaking and writing require production. They also require interaction. Speaking is both producing speech, but also interacting.
Yeah.
Now, here's where it becomes a little bit trickier. In real life, we don't use these 4 language skills in isolation. Almost never. I mean, an example of using language skills in isolation might be you're at the airport, you hear the announcement, and you really just use your listening skills there to understand what the announcement is, gate, change of the gate, and so on. So that's fine. But what you and I are doing
there's
what you and I are doing right now, I'm using my listening skills to understand to decode what you are saying. You pronounce, you say something, I'm listening, I'm trying to say, okay, that's what, and these are things that happen fast, by the way. The more proficient a language learner is, the more automatic these processes are. And that's a very unique feature of very advanced learners of English, this automaticity of listening. So I use listening, then I use speaking. I read something on the screen, I need to use my reading skills. I take some notes on a paper right now, I use my writing. So there's a tension there. On the one hand, we need to provide information about these individual modalities, these individual language skills. But for people like me, then the question is, how do they interact with each other?
Right.
And how do I make information? Because if you are, let's think of someone who is a nurse from another country, okay?
Yeah.
That person might have very elaborate reading skills. They can read very specialized reading passages. But maybe their speaking is not that developed because they don't interact in English every day in their country. Now they come to the US to work. Now, that person might not need much help developing reading skills, but they might need some help with their speaking skills. They might need some help with the influence that the first language has in their pronunciation, for example.
Or even immersion in a conversational environment, context where that can be practiced.
Absolutely, and context-specific speaking skills, where the nature of the job really influences what this person needs to say.
Right.
So we have this tension as developers of language tests, as teachers of English. In real life, we don't use language skills in isolation. But when we need to help people improve their English or need to provide individual refined information about language proficiency, we have to find a way to break down this information in a useful way. And one way to do that is to provide information about these 4 language skills. I have to say one thing that is very important for our discussion, that most language tests out there, they will give you information about your total language ability, the total score. There will be a total score, and there will be individual language scores, typically speaking, writing, listening, and reading.
Right.
One thing that I'm hoping people who need to work with language proficiency tests in the healthcare context need to understand is that all this information is important. Okay? Because, like I said earlier, people might have what we call uneven profiles. Someone might have very well developed listening and reading skills, but might need some help with writing or some help with speaking. Or writing doesn't matter, because most of the times a nurse writes very brief reports, fills out charts. Maybe you don't need to have the skills of writing an academic essay, for example.
A white paper.
Or a white paper, you're an academic paper. So these are
But documentation in a healthcare setting is very specific, and the complexity of medical language is wrapped in there as well.
Another big challenge. We'll talk about that as well. How specific can a language proficiency test be when we're talking about very specific uses of the language? The kind of discussion you and I have right now is very light on specialized language. We talk a little bit about a specialized topic, but it's not. We're doing it in a way that most people should be able to follow us. So it's very light on terminology and so on.
Clinical terms and treatment, diagnostic terms.
Yes,
that kind of
absolutely,
thing.
yes. And so bottom line with this question is that it's important when we want to have a full picture of someone's English language proficiency to consider not just one number or one score that reflects the overall ability, but to drill down into the specific aspects of language proficiency, in this case, the different language skills.
So let's talk about the correlation between language proficiency and professional or academic success. But in our case, we're talking about health workers who are, looking to move their skills into, a country where English is going to be their second language.
Right.
There's a lot of, fear and anxiety about having to not only reach a proficiency level in that language to pass the requirements for entry to practice, but to also step into those roles where they're patient-centric and patient-facing and be successful. Where do you see the correlation? Because there's a lot of weight that's put on one hand. There's a lot of weight that's put on these scores and on those proficiency levels to pass through those professional gateways to make that happen. But they're not always an indicator of success. In some cases, there's probably an over-rotation on that. And I know that factors into cut scores, which we're going to talk about, being too narrow versus too broad. But can you touch on what the correlation between language proficiency and downstream professional success really is?
I would say this is a great question, and probably if I would like those who are watching this episode to take away something, this is probably the most important aspect, which is both with academic, because I work a lot with international students who come to the United States and other English-speaking countries to study, but also professionals who need proof of language proficiency. Language proficiency is a necessary but not sufficient condition for success, whether it's academic success, whether it's professional success. Obviously, you need language proficiency.
Yeah.
If you don't have it, you're not going to succeed. That's
Right.
why I would say it's a necessary requirement. It's necessary, but it's not sufficient. And the best way to explain that in a simple manner is this. If language proficiency was the best predictor of academic or professional success, then native speakers of English will always be successful.
Right.
And those who are not native speakers of English would generally not be successful. You know that this is not the case.
It's not true. Right.
It's not true.
Not the case.
But here's where the misunderstanding is, and I see this a lot actually in the academic space where I work more, but I'm sure it happens also in the professional and a credentialing space. A student goes into the classroom in a university and has difficulty communicating or has difficulty succeeding, difficulty passing the classes, difficulty understanding the content, difficulty submitting very good assignments, and so on.
Right.
The easy thing to do is to blame the test and say that test didn't do a good job, that language proficiency test didn't do a good job because this student is failing academically. But there are so many other factors that affect academic performance, the same way that there are so many other factors that affect professional success, right?
Yeah.
So, knowledge of the subject, knowledge of the actual professional subject, do they know, are they successful nurses, for example, in the context of nursing?
Right.
What experience do they have? These are things that have a very important role, that play a very important role in success.
Yeah.
Then there are very personal factors. I'm thinking of a student that just arrived in a new country, or someone who left a country to become a healthcare professional in the United States.
Right.
Alone, having difficulty adjusting culturally,
Right.
Being homesick.
No family support,
normal.
no social system, support system.
I mean, we all felt that at different times in our life.
Yeah.
And that might reflect in your professional performance, especially in the beginning. Is it because you didn't understand what your supervisor told you to do? Or is it because you're dealing with so many other things that are happening at that time? Yeah. So, bottom line here is there is a relationship. Without language proficiency, without sufficient language skills, there's not going to be success.
Right.
But that's not enough. Language skills are not the only thing that will play a role in success. So that's why I say this when I discuss with university staff. We have put that in our publications as well, that we've developed to help our colleagues at ETS communicate this information. Consider all information you have for an applicant, not just the language proficiency score.
Right.
Just because someone comes from another country doesn't mean that the language proficiency score will be the only thing that you look at. And I'm sure in most cases we don't look just at the language proficiency score.
Right.
So that's the critical point here. You have to look at all sources of information you have in an application to try to get a good understanding of how well that person fits in this job, how likely they are to succeed in this job.
Yeah, absolutely. And yet for healthcare, I mean, and you've acknowledged it, it's still critical, that proficiency level. And in some cases, minimum proficiency is just the beginning of that journey. Upskilling in that language proficiency is not only beneficial to the patient, to the healthcare system you're stepping into, to coordinated care and collaboration of care with other colleagues, but to that getting out of that space of social isolation as well. So all of those things play a factor. But I would think it is a little more high stakes with healthcare because of the communication that needs to take place with a patient and their family members at very critical moments in time, right? We're talking about people who are in crisis or acute situations. So
the challenge with healthcare, in my opinion, from a language proficiency perspective, is that the kind of communication you have throughout the day is very different. I would say that me as a professional working at ETS, most of the times it's kind of a similar type of communication. But if you are a nurse, you talk differently to your nurse colleague the one who finishes a shift and you start the shift.
Yeah.
You talk differently to the nurse practitioner. You talk differently to the doctor. You talk differently to the patient. If the patient is a native speaker of English, if the patient has very little English.
Right.
And then the family. How do you talk to the family? These are very different contexts of language use. And the language skills you need to develop there they're similar, but they also have distinct characteristics.
Yeah. Yeah.
So that's what makes, I think, in my opinion, the stakes. The only other profession I can think of that is like a great example of high stakes context is beyond healthcare is pilots and air traffic controllers. That's a project I did in my early years as a professional.
Yeah.
Language proficiency for air traffic controllers and pilots. And the kind of communication they have. So it's specialized communication, but in the case of healthcare professionals, there's also a lot of daily communication, less technical communication with patients and families.
Well, and I had a guest on the podcast just a few episodes back that's a CNIO for Microsoft, and she was talking about, Kathleen McGraw, she was talking about the movement of nursing into more narrative care, where they're actually narrating out loud the care they're providing as they're providing it. Right. Not only does that support voice-enabled documentation in technologies of the future, but it also is going a long way in patient and caregiver communication. They can understand what's happening to their loved one while it's happening. So even not just talking to families, but actually dictating or narrating the care you're giving in real time while you're giving it won't make that an even more constant communication role. So probably
how challenging this is to be saying all these things and at the same time providing the care. It's a very challenging use of the language.
Yeah, it is. But it will be an enabler of technology moving forward. We talked a lot about the role of AI and ambient voice and the role that'll play. So as nurses move into that spectrum and are learning English as a second language, there'll be even more criticality on it moving forward, I think, for some of those technology enabling reasons. So it's a great that we're having this discussion today. Okay, so to determine proficiency against a benchmark means setting cut scores, which you mentioned earlier. ETS emphasizes applying cut scores in a principled manner. And you guys cite two principles that should be addressed in that process. The test design reflects the demands of the real life academic or professional task. And then the usefulness of the test score for making decisions is supported empirically by ongoing research. Can you address both of those, especially the first one, because it sounds like it's a fit for purpose proposition, right?
The approach here, and not only for ETS, but for many providers of language tests, is to design the test in a way that it reflects the real life demands.
Right.
So if it's a test of academic language proficiency, you would want to put some kind of academic passages that reflect the kind of passages that you will read when you go to college.
Right.
Or ask you to perform some speaking tasks that reflect the kind of speaking that you would do in the classroom. Listen to this lecture, read this passage, now summarize the key points that these two sources make.
Right.
So we try to be, another way to think about that is authenticity. We try to be as close to the real life tasks as possible. That's important.
Yes.
Because it's more likely that you will try to learn and demonstrate the relevant language skills if the design of the test reflects the kind of language that you need to use in the real world. Now, here's the challenge, though. There, unfortunately, a test it's like polls. Since we're very close to elections, it's like polls. It's a very short event, usually about a couple of hours, at a given time point, and then you want to take that evidence and generalize about something very elaborate.
It's a snapshot in time.
It's a snapshot at that time point of your language, of what you demonstrated as your language ability. So now, here's the challenge. It's impossible for someone like me, working with a team of experts in designing a language test, to include every single possible task that whose proficiency you need to evaluate. It's impossible to have every single task in the language test. So, we try to also design test tasks, activities in the test that we know can elicit language that is useful more generally.
Right.
So there's kind of a tension, and we try to strive for balance between, tasks that look real life and realistic and authentic, but also elicit a lot of information about language proficiency and so on. Thinking, for example, how do you evaluate someone's reading comprehension? Reading or listening is very internal. You don't see it, right?
Right.
You can hear or see it. You can hear what I say, or you can see what I write, but you cannot, see anything about my reading ability.
Right.
So now you have a task where you ask them to select options. They read the passage, and in real life you don't select options.
Reading comprehension.
Reading comprehension test. You have 4 options for each question. Reading comprehension questions. We don't do that in real life, right? But we try to simulate. We try to elicit evidence of these internal functions, internal processes, comprehension that is going on at that time. Yeah. The other challenge with those of us involved in language tests is that we cannot make a language test way too specific, because, and I mean specific in terms of professional context, academic context, and so on. Yeah. Because then the test becomes, there are a number of problems with that. First of all, it's impractical. It will take forever to develop and so on. It'll probably be very costly.
Right.
But also then we move away from evaluating language proficiency, and we're starting evaluating academic skills, professional knowledge, right, and so on. Yeah. I'm going to use the air traffic controller test that I remember that very well because it was my first years of professional life. That test of language proficiency was so specific that very few native speakers of English could get it right. Very few, because it was going beyond language proficiency. It was testing terminology, knowledge of terminology. And so this is the big challenge.
Which is probably relevant, but a different exam and not the role of a language proficiency test to evaluate, right?
And because a language proficiency test should evaluate language proficiency.
Right.
Not professional skills. You have other tests for professional skills. It's not the job of a language proficiency test. Now, that takes me to the next part of your question, which is ongoing research. And I think that's where you see a difference in the language tests used around the world. Responsible test providers make claims about how the scores should be interpreted, how they can be used, but also provide evidence, evidence that the scores actually work the way they're supposed to work. Here's a simple example. We had the study, we wanted to show that the speaking scores of our test were meaningful indicators of language proficiency in academic contexts. We organized a study where we had students being evaluated in tasks they did in their labs, in their classrooms, and then we gave them the test. And we tried to see, is there a relationship between the language proficiency score and their performance on these tasks when they speak in the classroom? It's not going to be a perfect relationship, again, because it's not just about language proficiency.
Right.
But there was a clear relationship. People who tended to have higher speaking scores also tended to perform better in their academic tasks. And I would love to replicate a study like that in more professional context. Yeah. But that's what we see in research. The bottom line here is you cannot just say, this is a great test, use it, it's going to help you. You have to provide the evidence, and your research has to be structured in a very principled way with claims that you make about the test and the design of the test and the scores, and what evidence you have. And you have to have evidence from your own research teams, outsource research or commission research with independent teams as well to provide this evidence. And that's one of the, as a researcher, I consider myself very lucky to work at ETS because working in a research organization allows us to do this kind of research. It's part of the mission of the organization to do that, and gives us the opportunity to explore some exciting options in terms of how we do research in English language proficiency.
Absolutely. So let's talk about cut scores, because they are certainly a hot topic for candidates and applicants who come through these programs, and why do they have to be so high, or can I go to a competitor and find make my way through with a lower cut score? CGFNS, we've pretty much taken the position of adopting strong cut scores for verification, based on the feedback we get from our nursing boards and the recipients of our reports. But it is a very hot topic, and there are some considerations to balance. We're talking about cut scores that can be too high, and others that are too low, right? And you can understand why those candidates would ask, why can't you accept a lower cut score? I feel like I'm proficient enough to do what I need to do. There are a lot of hoops that people have to jump through to take their careers and move from one location to another. But there are certainly stakeholders who have an interest in the outcome: patient, health system, employers. But also the applicant, the candidate, the health worker that is stepping into those roles. So let's talk about the balance. What are the potential consequences of setting a cut score that is too stringent versus setting a cut score that's too lenient? The pros and cons there, because I know there's a balance that you strike when you're looking at those.
And that's how I usually like to frame the issue of cut scores and lower, high, stringent, or lenient cut scores. Let's start with the consequences.
Right.
Okay, let's think about the consequences.
Yeah.
If I set the score requirements, if my cuts are high, if my cut scores are stringent, right?
Yeah.
That means that I can be more confident that those who are those who are accepted, those who are qualified, are actually qualified. They do have, in the context of a language proficiency test, that means that they have the language proficiency skills to perform the job.
Right.
I can be more, as I increase the score requirements, the more confident I can be.
Right.
Okay? On the opposite side, if I lower the score requirements, I cannot be that confident, because what's going to happen is I'm going to let in people who might not have the required language proficiency skills.
Right.
And I would point out here also that we need to remember that scores, not only of language proficiency tests, but of any test, even a test that you do for healthcare, there is some error there. There's always some variability, right? But especially with language proficiency, because it's such a abstract trait, it's not counting, it's not weight, it's not height, it's not physical traits, it's psychological traits.
Yeah.
There's even more error there. So you got 90 today, maybe tomorrow you got 91, maybe you're gonna get 89. So if I'm in a healthcare context, we need to think about the consequences of these cut scores and the consequences of qualified versus unqualified people. And I think everybody would agree. I'd rather leave some qualified people out and have some very negative consequences in the quality of healthcare.
Right.
As opposed to, so I'd rather lower the chances of false positives as opposed to false negatives. That's false positive, false negative now. Since the pandemic, we've heard a lot about false positives and false negatives. So in general, you would expect that in a high stakes context like healthcare, you would rather be confident that someone has the language skills than not.
Right.
I would also like to point out that there might be cases where we might think about lowering score requirements, but we have to do that in a very responsible way. For example, if I have, a hospital that struggles to recruit nurses, what is the most important thing there? To have nurses that might struggle or we might take a little bit of a risk with their language proficiency than not having nurses at all. I'm thinking of, hospitals in rural areas. I was born and raised in a country with many islands. Greece has tons of islands, right? Yeah. Those islands, their healthcare is a very challenging situation, especially in winter. Staffing those, and in the US, I assume, rural areas are more challenging to staff than urban areas.
Yes.
So the question then is, should we lower score requirements to let more nurses be eligible, or doctors or other healthcare providers? Maybe that's an option. but we have to do that in a responsible way.
Yeah.
So,
especially when you're talking about somebody who has the clinical skills, there would
and
there would not
everything
be a
else is
patient
great in
risk
that application.
associated with their clinical skills,
Right.
And there would be an opportunity to remediate or upskill and get their language to the level that's commensurate with their
The key word
clinical
there
skills.
is remedy. Will you give them opportunities to recertify the language proficiency in a few months? Maybe if they got a few points below the CAT score, maybe if they just go and take the test again in 3 months after they lived in the country for 3 months, maybe that will allow them to meet the requirement. Or what about offering them, sponsoring them to go and attend language classes for adults as soon as they arrive? Give them a month to attend some classes, especially, and also the other thing is, how far are they from the score requirement? If they're a couple of points and everything else looks great in their application, and you can offer them some language proficiency classes, maybe it's okay. And I think that's my concern. There's no rule. With CAT scores, we need to understand this is the biggest challenge, in my opinion, for me as a professional to explain. There's not a single CAT score that works for everybody.
Right.
Think of it also in the context of university admissions. Some universities are very competitive. They have no problem recruiting international students.
Yeah.
They can choose the highest CAT score they can have. Some universities might need to fill in seats. They might think, okay, let's bring students in with lower score requirements. Here's the problem with that, though. The experience of the student, or in the healthcare context, the experience of the nurse, without the sufficient language skills, is going to be very negative.
Yeah. And that's a decision that has to be really made at an employer level or health system level, right? Certainly not something we would, put our hands in as an evaluating body or a verifying body. But I do think especially when we look at the global critical shortage of nurses. I mean, not just in rural areas. We have a significant shortage of nurses in the U.S., which is why, that makes it even more attractive, I think, for folks to come here and work. The fact that there's opportunity here and other countries, but when you look at critical shortage, you have to think of those employers would need to really evaluate that proficiency through somewhat of a sliding scale based on need and as you said, the willingness to invest in remediation or invest in those that upskilling could certainly open the aperture a bit for international health workers who are coming into those jobs. I certainly think it's a compelling proposition, and one that would sit at an employer or health system level when they're really looking at how they're meeting their workforce needs. So that's interesting for sure. There are English proficiency assessments that are industry specific, although I think you said at the front end they're probably not nursing specific, but there are some industry specific proficiency assessments that people are able to take. Can you talk about those? What are the pros and cons of a more granular assessment as in healthcare over a general one? I'm assuming some of them are very narrow and others too broad, but do you recommend one over the other?
Yeah, absolutely. The general principle here would be that the more specialized the language proficiency test can be, the better for decision making. So if I can have a healthcare language proficiency test, that might give me more relevant information than a general proficiency test or an academic language proficiency test. So that's the general principle. But again, when it comes to real life, things are not as clear cut.
Yeah.
First of all, language proficiency tests, they have to be somewhat general. So talking about the tests that I work with, that they intended to be mostly geared towards uses in university context, but there's no specialized academic language in it.
Right.
An educated learner of English who takes TOEFL, for example, should have no problem taking the test as long as they have the language proficiency level, should have no problem taking the test, understanding the content in terms of content knowledge, in terms of subject-specific knowledge, because that's the fair thing to do. We don't want to disadvantage one group over the other. Whether your background is in healthcare or it's in social sciences or in engineering, that should not affect your language proficiency score.
Right.
That's the challenge here. So it's the same with healthcare. Are we going to design a language proficiency test for nurses that is so specific that comes down to nurses working in specific parts of a hospital, for example?
Yeah.
Is it going to be specific only for doctors and so on? So there's this tension where you want to make the content relevant but not too specialized, because now you're moving away from language proficiency into professional knowledge.
Professional content, yeah.
And that's not what you should be assessing if it's a language proficiency test. We need to take also the perspective of the test taker. There are very simple things, but important things that the test taker will have to consider. Is the test easily available to me? If it's a very specialized test, does it mean that it's offered very few times of the year, only in very specific locations? If it's a more widely accepted test, is it easier for me to find a location to take it? Can I take it from home? These are the kind of considerations that are real and important. So I would change the direction of this argument somewhat. You want a test that elicits information that is useful.
Right.
If it happens in the context of using English in the context of healthcare, that's even better. But a well-designed language proficiency test should give you relevant information without getting into the area of professional knowledge too much. It's a tension for us in who develop language proficiency tests. How industry specific we want to be with our tests and keep it still a language proficiency test.
Out of curiosity, are any of those questions scenario based, where you might ask someone, and I'm thinking in a patient setting, where you're less concerned about the clinical explanations as you are about the way that would be communicated? If a patient was needing to be reassured about something, how would you walk that patient or their family through an understanding of XYZ? It seems to me those would be more meaningful but harder to grade or score, because there's a lot of subjectivity there, I'm assuming. Yeah.
Yeah, and now we're getting into other issues of task design. Are we designing content that meets with language tests, we have very strict requirements about what can go in and what cannot go in.
Yeah.
We have to be very careful not to violate specific principles of test design, fairness principles.
Right, absolutely.
And so these are all very sensitive topics. Here's an example. Death, which is very predominant in the healthcare field, right? It's what we're trying to avoid. And pain and death are not the most popular topics to go into a language proficiency test.
I bet they're not.
I will tell you, probably almost certainly violate some of our good practice design principles for a language proficiency test. But they're very important subjects for healthcare professionals.
I think of all the conversations that nurses have with patients and their caregivers and family members throughout the day, and some of them are just explaining routine procedures, reassuring them about the process that they're going to go through, and very procedural, and but they go a long way in comforting the patient and family that appropriate steps are taken. So there is a lot of dialogue that takes place. And then, like you said, a whole different level of dialogue that takes place nurse to nurse or nurse to physician, in those settings, where from highly clinical to much more vernacular, conversational, with the patient and family. So it would be an interesting challenge to assess readiness in those areas. But that's very interesting. So EOP assessments are designed to assess minimum proficiency, but ultimate long-term success may well rest on a candidate's willingness, as we discussed earlier, to embrace upskilling. Whether or not that's offered or provided by an employer, still a recommended pathway beyond just that minimum that assessment of minimum proficiency, right? What's your advice to global nurses? We're coming up to the close of our time, so I'm interested in your advice to global nurses and other health workers for whom language proficiency might be their biggest barrier right now to, potentially pursuing career mobility, but to long-term acclimation and success in a new country. What advice would you give them about that journey and not just the gateway they have to go through for a proficiency test?
Absolutely. We're very fortunate. We all live now in a technological era.
Right.
Technology gives us unbelievable abilities. When I'm trying to remember 30 years ago when I was learning English, it wasn't getting original, authentic input was very difficult. Now, you just need to have an internet connection and a computer, right, and you can have endless number of hours of language input. As long as you have a computer and internet connection. There's also dedicated apps for language learning. There's materials out there. So my general advice is use all these resources that are freely available. You don't have to pay anymore to get this input. Little tricks help. Watch a movie, put the subtitles. I still like doing that, actually. I like to put the subtitles in English, not in Greek, in English, because it helps me sometimes, or if I don't hear something because the volume is low and so on. So
we have subtitles on all the time in my house, and I'm getting older, so some of it's just you can't catch everything they're saying. But
it's actually
it's a good practice.
It's a very useful, simple trick.
It is
for language learners. I would say actually when I was little, that was my trick to get input. Subtitles helped a lot. Like I said, there's apps on the phone that you can use. There's libraries are now, when I go to the library, my local library, there's many books that for other languages and so on.
Well, and books and audio too. You hit on something there that even as a mom of when my kids were learning to read, and English was their first language, there's something powerful about reading and listening simultaneously in terms of learning. So when you talked about the subtitles, even downloading a book on Audible and listening to it read while you're reading the book is a great accelerator of language assimilation and learning. So that's an interesting topic.
I would also say that we need to think about language beyond being a subject for learning,
right?
But a vehicle for culture, for social assimilation, and so on. So one thing that I would definitely recommend is go to your local book clubs, go to even classes for adult language learners, just to get an opportunity to use the language and use the language as a vehicle to learn other things. It's not just about learning English. It's about English as part of living in an English-speaking country.
In a community, right?
In the community,
absolutely.
So use all these available resources. There are more than enough out there. And just a few months of using those resources should definitely have a positive impact on a nurse's language proficiency level. There's no doubt about that.
Yeah, and probably nothing better than just the immersive experience.
Absolutely. There's no better way than it's all about exposure.
It's
all about exposure, input, and so on.
Absolutely. Well, Spiros, thank you so much. I would just, my final thought on that to our audience, to anyone, all of our health worker, nurse audience that listens and is somewhere in this career journey right now is, once you've made it past that proficiency test point and you can take a deep breath that you've hit your cut scores and you're able to move forward towards your career dreams, keep learning, keep embracing that upskilling and learning, because minimum proficiency is never the goal. Fluency should always be the goal, and that doesn't happen overnight. That is a lifelong journey for sure. So thank you so much. This has been a great conversation. I know very helpful to a lot of folks in our industry, or like I said, the health workers who for whom this most applies, or to whom this most applies, that go through these stage gates and gateways for career mobility. Thank you for unpacking all of that for us today, and how those benchmarks are set and established, and how important those cut scores are, and giving us putting some humanity around that as well. So we're not just looking at cut scores through a very legalistic narrow lens, simply for regulation and approval, but also for ultimately to help develop our global workforce, which is such a critical need for the world right now. Thank you again for being here. Great conversation. All right, everybody. Thanks for joining in today. We'll see you back for the next episode coming up in 2 weeks. We'll talk to you later. Bye-bye. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at cgfns.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.